we're not mic'd. Now we are. It is Monday, February 13th at 1:30. We'll call the Wright County Health and Human Services Board to order. We'll begin with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Welcome, everyone. I see we have a good number of new staff in the room, as well as a variety of presenters across the HHS departments. So thank you for your attendance. We'll start off with the dispensing of the minutes from the January 9th Health and Human Services meeting.
Mr. Chair.
Yes.
Item 2, first action item, there's an error. I wasn't nominated for vice chair. I believe it was Commissioner Shane.
No, I think that was the other board. I think this board you were.
No, I watched the replay too, and
Oh, really?
because when I read it here, it didn't seem right. But
I think if we could review the audio, then we will bring that back to the next board meeting. As far as just in, we'll put it in our minutes for this board meeting.
okay.
There you go.
My recollection that it was also Mike, but my recollection isn't always great, so.
Trying to sneak out of it.
Yeah, exactly.
In the short tenure that this board may still exist, we'll get it ironed out.
We also had a correction for the board minutes, and it's, you should be able to see it there. Do they have that? Okay, so you should have the corrections under 2A to the 1-9 board minutes as well. Item 5A, 1 and 2.
All right, perfect. So with that, we'll approve the minutes with the return of the corrected item regarding who is the vice chair.
Yes.
I'll make that motion.
Second.
All right, we have a motion by Commissioner Catchmark, second by Commissioner Shane. Is there any further discussion? Hearing none, all in favor say aye.
Aye.
Opposed, same sign. All right, minutes are approved. So moving on to the agenda today, is there any additions to today's agenda?
No additions.
All right, hearing no additions, I will stand for a motion to approve today's agenda as presented.
So moved.
Motion by Commissioner Dietrich,
I'll second.
second by Commissioner Catchmark. Any further discussion? Hearing none, all in favor say aye.
Aye.
Opposed, same sign. Agenda is approved unanimously. Moving forward to the consent agenda. Anyone like to remove anything from the consent agenda? It's quite lengthy.
Mr. Chair, I'll make a
That's
motion
being
to
facetious.
approve the consent agenda.
All right, we have a motion by Commissioner Catchmark to approve today's consent agenda.
Second.
All right, we have a second by Commissioner Shane. Any discussion? Hearing none, all in favor say aye.
Aye.
Opposed, same sign. Consent agenda is approved unanimously. Staffing announcements. We have 3 new staff here. I guess we're going to do a brief introduction there.
We would love to do that. Commissioners, I'm happy to present to you our 3 new staff in Health and Human Services, starting with Sandy Iverson. She's, if you'd like to stand, Sandy, she is a new eligibility specialist in our Family and Adult Benefits team, which we call the FAB team. She reports to Michelle Zeck, and she started on January 23rd. Sandy, would you like to stand? Oh, you did. You did. Okay.
Welcome.
Oh, you are.
Oh, no.
I'm looking at the screen, and honestly, it looks like you're still sitting. Sandy, could you tell us just a little bit about yourself, please?
I'm in the family section, so we'll be doing the family benefits portion of that. Before that, I was a patient care coordinator with a large mental health clinic. And before that, I did program management for groups with developmental disabilities.
Thank you. And where do you live?
I live in Big Lake.
Big Lake. Thank you, Sandy.
Welcome, Sandy. Appreciate you working here in Wright County.
I
Looks
apologize.
like you're bringing a wealth of knowledge to the team there.
Mr. Chair will note that Sandy is now sitting.
Where's Sandy? No, kidding. We also have Carly Jo Young. She's our new social worker on our assessment services team, and Carly also started on January 23rd. Welcome, Carly.
Thank you.
Carly Jo.
Yeah, so I'm a
New Choice's initial assessor. Before this, I was a case manager through Thomas Allen, which is contracted case management. Before that, I worked in HR for 2 years, and then I'm also an occupational therapy assistant. But yeah, I live in Maple Lake, so yeah.
Welcome.
Thank you.
And Carly Jo reports to Rochelle Kramer.
And as,
Third, we have Kelsey Brandt, our new office technician 1. So she's the friendly face of our front desk. She started on January 30th. So welcome, Kelsey.
I am on week 3, going on week 3, and I came from a mortgage background, so I like staying busy.
welcome. Thank you. Well, we appreciate all 3 of you joining the team here. Look forward to sharing your wealth of knowledge with us here at Wright County and helping our citizens. Thank you.
Thanks.
Now the March Employee of the Month. Start the
Yes.
drum roll.
Yes, exactly. And I would like to invite Michelle Richer to come join me at the podium. Our March Employee of the Month is Michelle Richer. Michelle is an adult mental health social worker in our mental and chemical health services team and has been with Wright County for nearly 20 years. Michelle started as an intake worker until 2017 when she joined the mental health team. Michelle has a wealth of knowledge from her time in general intake. Her nominator, Margaret Munson from Court Services, states, Michelle and I were servicing the same client. The client had demonstrated some extreme behaviors toward her family with the result that there was a criminal case pending a Rule 20. The person was in the community and subject to conditions of release, including GPS. Michelle was well prepared for the court case and it was approved for commitment. Michelle and I worked to locate the person. Michelle then drove to the parking lot where the individual was living, and law enforcement was able to get this person into custody. Michelle went above and beyond to follow this individual, communicated well with me, and showed care and commitment to this individual. The individual is now in a facility and getting the care that she needs. Thank you, Michelle, and congratulations on being our HHS Employee of the Month.
There you go. Thank you.
Congratulations.
Congratulations.
No, nothing. I don't know.
Congratulations.
Thank you very much.
Thank you. Moving right along here into the regular agenda, social services, public health, financial services, proclamation of Social Worker Month. We have a proclamation included in the packet that will be posted out for the employees, but we would look for the board here to make a motion to declare the month of March as Social Worker Month here in Wright County.
And Jill Pillow would just like to say a couple words about our social workers here in Wright County.
Just bringing before the board a proclamation for March being National Social Work Month. It's a time that we like to honor a lot of our staff and do some different fun activities, put some things out on social media. Throughout the year, we also have a case aid day and an administrative assistant day, those kinds of things to just there to show some recognition for the hard work that our staff do. And we like to bring that before the board for a roll call vote to accept the proclamation.
Do I have a motion?
I'll make that motion.
All right, we have a motion by Commissioner Dietrich.
I'll second that.
Second by Commissioner Holland for the proclamation declaring March as Social Work Month here in Wright County. With that, we'll do a roll call vote. Commissioner Ketchmark.
Aye.
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 It is now official. March as Social Worker Month here in Wright County for 2023. Thank you.
Thank you, board. Thank you, Jill.
Now moving on to the presentation for Mental Health Advisory Council Unmet Needs Support. So this is a document that they put out annually illustrating the areas that there is demand and need for capacity for these services here in Wright County.
Right, so this is the time we ask the board to, our HHS board, to consider the unmet needs. Again, it's a statutory requirement, and Diane Erkins is here to kind of frame that up and introduce you to our board member who would like to do a short presentation for you.
Hello, board. So a statutory duty of our Mental Health Advisory Council for both children and adults is to present any recommendations and also unmet needs that we determine in the community for both children and adults of mental health. And so I have here Jocelyn Alexander. She is one of our advocates on our Mental Health Advisory Council, and she would like to present the unmet needs today.
Thank you so much. Appreciate it. Hello, everyone. Good afternoon, commissioners. As mentioned, my name is Jocelyn Alexander, and I am a mental health advocate, and I am here today to present the Wright County Mental Health Advisory Council Unmet Needs 2022. To start out, I am going to discuss what mental health is, talk about who we are, our unmet needs for 2022, and give you some information about a wonderful class called QPR. As I said, my name is Jocelyn Alexander. I am with the National Alliance on Mental Illness, which is NAMI, Minnesota. I am also a group facilitator for individuals with lived experience with mental illness. I am on the Wright County Mental Health Advisory Council, and I am also now on the Community Mental Health Initiatives Joint Powers. To define, mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It determines how we handle stress, relate to others, and make choices. Mental health is important in every stage of life, from childhood and adolescence through adulthood. The Mental Health Advisory Council, we are a broad range of people who use mental health services, provide services, or are concerned about public policy, finding ways to improve local mental health services. MHAC focuses on making recommendations and identifying gaps and needs in mental health. The items for discussion that we went through for 2022 is the lack of mental health providers to offer services for children struggling with depression and suicidal thinking, additional training opportunities available to providers and concerned citizens on mental health, lack of housing and the rising population of people experiencing homelessness in Wright County, a need for more housing, and lack of mental health beds. The need for more providers able to accept targeted case management clients on managed care plans, lack of safety net services and placement options for adults and children with significant mental health and behavioral needs. In regards to the lack of mental health providers for children, the solution discussions are Central Minnesota Mental Health and other community mental health providers are struggling to hire staff due to the staffing shortage. Central Minnesota Community Health Center is providing updates and available support options to venues such as Safe Schools, MHAC meetings, and through our community partnerships, discussion hotline options such as 988 and our wonderful mobile crisis teams. Additional training opportunities, solutions that we discussed, our Community Mental Health Initiative continues to share training opportunities with the MHAC team, and team members are able to share appropriately within the community. For lack of housing, we do have a rise in people experiencing homelessness. We have a need for more housing, and we have a need for more mental health beds. Solution discussions, Wright County has outreach social workers available to connect community members struggling with homelessness to resources. The need for more providers able to accept targeted case management clients on managed care plans. Solution discussions, Blue Cross has been working to recruit additional providers. Lack of safety net services and placement options for adults and children with significant mental health and behavioral needs. Solution discussions, the MAC, SSA, and AMC have legislative position statements attempting to address this concern. And to wrap up, as I mentioned, we do have a class called the Question, Persuade, Refer, known as QPR. This is done by Keith Bennett, who is a Master's of Public Health. He is the Health Promotions Coordinator for Wright County. What QPR is 3 steps to save a life. This is set out as 1, question the individual's desire or intent regarding suicide. 2, persuade the person to seek and accept help. 3, refer the person to appropriate resources. This is available to everyone. I highly suggest taking it.
I'm just going to insert, I did get to go to this class, and it was well presented, and it was good information, and even just tying it to that same kind of idea as CPR. I mean, this should be out in the community, and so we can all support each other.
Yes, thank you so much. I'm glad. Thank you so much for taking it. I thank you all for your time, and what questions do you have?
No, good presentation. Same kind of struggle out there with trying to recruit mental health professionals. Unfortunately, I think it's probably a bigger issue because right now trying to recruit, you're just taking one from one pool and putting it into another. I think it needs to be more of a holistic view from the educational requirements and the compensation, and making sure that that's in line with the market overall. I think that's where the biggest struggle with mental health professionals is that the educational requirements are high and the compensation is low. So a lot of people end up going down other avenues if they're going to go and do that much education. So until that's recognized, I don't know that it'll have a whole lot of momentum from an improvement perspective.
Speaking from the NAMI side, I do know that there is continuous legislation and policy that moves forward in regards to addressing that. Things like loan forgiveness, increasing, funding for mobile crisis teams and services, to changing licensure and supervisory hours. So there's quite a few things that are being done on that level that were done in 2022 and are carrying forward in 2023.
Are they doing anything from NAMI perspective in terms of having more like a PA type education versus a full-fledged psychologist? Like you can get a lot of PAs that specialize in orthopedics, but I've not seen any of them that have been able to specialize in like a psychology type field, so that taking that one burden down, that you can get more people as a mental health professional, but not quite that whole MD.
Yeah, I hear you and I agree with you. And we do have options like peer support specialist training for people like me with lived experience who can go alongside with the individuals in crisis or going into targeted case management, armed services, where we can be there as an advocate for individuals who are going through that at the time. We don't have the training in regards to like a master's or PhD level, but we do have the lived experience and have had the chance to go through what the mental health system is.
Well, I appreciate the efforts. I think it just got to keep at it.
I just have a quick question regarding the amount of beds available. Is that addressed at a state level, or how is that ultimately, where would it have to shake out?
That does come state and county. Okay. So there is a difference. I don't know if Diane can speak more to that. We did have an increase in bed numbers, I believe, from 5 to 9.
Yeah, so there's a couple different options that we have when we're talking about treatment. We have residential options and then we have hospital options. Okay. So hospital options are run by the state or private entities. And then our residential options, we have some state-run facilities and then mostly community-run facilities. So it really depends on, what kind of population they want to serve, if they're targeting a specific audience for that population. For instance, we have some facilities that are focused only on females or, provide certain treatment.
Okay, all right, thank you.
Commissioners, one of the issues that we have is like when people are remanded to like the Anoka Regional Mental Health Treatment Center, when they're done with their stay there, we have a lack of places for them to go when they leave the hospital, which then, I'll just bring in the fiscal note, which then requires the county to pay a per day stay until we can find a place for them to go, and that per day stay tops $1,300. So that's something that we encounter and is part of our budgeted, our HHS budget.
So maybe you can debunk this myth, and from what I've been told is that the issue is more in residential behavioral health need for beds than it is for addiction, because there's a lot of treatment out there for addiction. There's actually, in some areas, there's almost a surplus, anecdotally I've heard, but from a behavioral health perspective is where we're really lacking from getting beds. But I don't know, maybe that's anecdotally. So
yeah, high behavioral needs, self-harm, self-injurious behaviors, maybe not needing that hospital level treatment, but needing that step-down care is extremely difficult to find. The waiting lists are weeks and weeks for an IRTS facility, which is our intensive residential facility. And so that's when we encounter things like not meeting hospital level of criteria, ready to discharge to a lower level of care, but there's not a lower level of care available for a number of weeks. And then we as a county have to foot that bill because there's waiting lists in the community.
And anecdotally, on the other side of that, we did meet as directors, our 4 county directors, and the Central Minnesota Mental Health Center's new building with additional detox beds. They're not full all the time, so they do have openings there. Commissioners, there's just one quick item. Ms. Alexander mentioned homelessness. January is the month that we do our point-in-time count. Last year, we did a point-in-time count and we came up with 8 homeless people. This past year, we did it just this past month, and it was 88 people. I don't know if that's a reflection. I'm assuming it's a reflection of probably both. We looked harder and there were more people. So just an awareness on that homelessness part. And also this is an action item that the board accept this as a report for the unmet needs.
All right. So,
Mr. Chair, I want to say too, I went to 2 Safe School meetings last week, and I think you can tell the frustration with the staff post-COVID, where they're seeing a lot of more mental health issues coming through the school hallways. So I appreciate everything you guys have done, because I'm sure you feel like you're swimming. And but yeah, it was quite alarming to hear their frustration on that, so.
Yeah, that social isolation did not do the students any favors.
No, it didn't.
None of us.
Yeah. Thank you.
great.
We would like an action item then. to
All
accept
right,
it.
well, entertain a motion to, for the, I guess, I'll call it the report, to retrieve the report for the unmet needs.
Yes.
There you go.
I'll make that motion.
We have a motion by Commissioner Holland, second by Commissioner Shane. Any further discussion? Hearing none, all in favor say aye.
Aye.
Opposed, same sign. Thank you for the unmet needs report for mental health.
Thank you. Appreciate it.
We'll do a presentation on statewide health improvement partnership. We have a variety of staff here that are involved in that partnership that are
Our SHIP partnership.
ship.
Bunch of us.
Ship.
So, board, I'd like to introduce Becky Graham, Keith Bennett, Ellie Benas, Megan, Kai Sin, and Nadia.
Thank you, Ellie.
Essential part.
All right. Good afternoon, everyone. Here we're talking about a statewide health improvement partnership, SHIP mainly, that's how we refer it to as. Just to give you a understanding of our SHIP team here, we have our team right behind us right here. Relating to me, Keith Bennett, I'm the SHIP coordinator, also health promotion coordinator for Wright County Public Health. Well, also we have Becky Graham, and then we have Ellie and Kai, Megan, and Nadia. That's Nadia. Thank you. And our SHIP team, each of us focus on a specific context area, which we'll talk about in a bit here, but also certain tasks. But we collaborate on so many things, so many projects together. And what you should have in front of you is our annual report for 2022, which would be a good reference to what we talk about today. We will cover bits and pieces of the report, but a lot of the things we'll cover today is reintroducing SHIP, but also how we do our work within it. Just to give more context to our statewide health improvement partnership, in 2008, Minnesota lawmakers recognized that high healthcare costs would be resolved through prevention efforts, and so invested in a health reform law that created SHIP. SHIP is a comprehensive health strategy coordinated across all Minnesota's 87 counties and 10 tribal nations. We work at a local level to invest preventing chronic diseases before they start. Wright County has participated in this grant program from the beginning, since 2008, 2009 area. As indicated in the Minnesota statute, SHIP's purposes is to address the leading preventable causes of illness and death, including poor diet, lack of regular physical activity, commercial tobacco use or exposure, and other issues determined by the state. Second, promote and use of evidence-based community-level comprehensive strategies to create healthy communities, and measure the impact of evidence-based community health improvement practices. Of course, you can see this is a very complex, comprehensive nature of this work. Requires strong relationships, as we always develop our relationships through the communities. Partnerships and expertise at the local level, And SHIP work is informed by local data and local community leadership teams that bring expertise and connection to the table. Next, Becky will go over SHIP's working structure.
All right, so on the left side of the screen, you'll see where SHIP is we're calling them context areas. They're new to us this year, so SHIP fully changed from year 5, year 2 to SHIP 5, year 3. So it's a big switch for us too. So now we are working on Minnesota Eats, Minnesota Moves, Minnesota Commercial Tobacco Free, and Minnesota Wellbeing. And then with those 4 context areas, we can use those in those 5 different strategies. So in the community, workplaces, schools, healthcare, and childcare. We have not worked in the childcare strategy for a couple years, but the other 4 we do actively do that work in.
Something pretty unique about SHIP is the focus on PSE, policy systems environment change. The PSE change approach seeks to move past hosting a program or hosting a one-time event to changing the societies and changing the built environments to promote health. So as you can see on here, a policy change is some type of intervention that creates or amends laws, ordinances, resolution, mandates, regulation, rules, and that can exist on any level, whether it be within an organization or within some type of government system. System change involves changes to processes within an organization, such as requiring like a screening for food insecurity and some kind of clinic system. And environmental change is a change to the actual physical environment, such as adding a medication disposal box at a new location so people can dispose of their medications. PSE changes can be individual in approach, but they do work best when paired with others. And so we as a SHIP team work together to ensure that we're layering different policy systems and environmental changes to make the change stronger. The framework of PSE change really thrives on getting buy-in from community partners, kind of ensuring the long-term sustainability of the work that we do. It also helps ensure that local SHIP, us, can be seen as a partner in doing work as opposed to a funder. We can really connect, we can maintain long-term relationships with different organizations, and we can ensure that the work is being done on a large comprehensive level, really increasing kind of the bang for our buck. The figure on this screen helps describe a little bit more of the difference between an event or program and PSE change. I think now we're going to roll into talking a little bit more about each of our context areas and the type of work that goes into each one.
All right. So Ndai and I both work on MN Eats, and we're just going to give you a little idea of some projects that we have worked on. So I'm specific to breastfeeding. So in the past, I've collaborated with Lina Hospital to offer Baby Cafe. It's a breastfeeding support group in the community that's free for members to attend. And then an example of workplace changes is I've worked with different school districts to implement lactation support policies and create spaces for their employees to use throughout the day to support breastfeeding. So that's kind of what Ellie was talking about with the policy change, but also an environmental change.
I focus more on the community, and I have not done any work in healthcare yet. I'm exploring that, but I do focus more on community and school setting. In schools, we do farm-to-school project like smarter lunchrooms. Personally, I am kind of newish to this, so I've not done a project in smarter lunchroom, but I'm exploring that for the next SHIP cycle. However, I've done project in the community on SNAP acceptance in at farmers market, and then also I am planning to work on a super shelf, which is a strategy where we change the food shelf so it can be a little more appealing and client choice, where the client feel like they're coming in and they're picking the vegetable that they want. So with that, we collaborate with farmers, my apologies, super shelves to make it work. So pretty much it, I think.
Question, Medaya,
Yes.
Would the farmer's market, is that like in St. Michael, Albertville? I can bring my grandkids and they get a little disc for $2. Is that the?
Yes,
And then they can buy
absolutely.
whatever, like vegetable.
Yes, so that's called Power of Produce.
Okay.
So any partners or client that purchase their vegetable through the SNAP program receive a token. For kids, they get the Power of Produce token that kind of matches what the parents, I think, buy. I'm not sure exactly how it goes, but yeah. And then we also have Market Box, which kind of triple up the amount of what they receive. So, for example, if a person purchased grocery with their SNAP benefit for $10, they will receive a Power Produce match and the SNAP Market Box match. So it's going to be $30 instead of just $10. And they get to use that for vegetables and fruit at the farmer's market.
Well, it's such a great program because they said, and I can see it with my grandkids, they say that if they buy the produce, they'll be more willing to go home and have mom cook it and help them cook it and eat it than if mom just puts it on their table. So
yeah,
it's a huge hit in St. Michael, Albertville. Plus it helps the farmers that, they know that these kids are coming and they get, sales from the various. So yeah, it's a great program. I hope that we can keep doing that. It's awesome.
Yeah. Yes, so that's the goal. We're trying to encourage that at all farmers market as much as possible.
Yeah.
It's the more the kids have that opportunity to purchase their own vegetable, they're more likely to eat them. So
yeah,
we want to encourage that in the community.
Great, thanks.
And I also do the Move strategies in all settings. For this one, in community settings, I do work with parks and cities on implementing like comp planning and updating the comprehensive planning and park planning projects. Also, we're hoping to start a cultural liaison at the park. That's kind of what I'm thinking about, but not there yet, but that's one of the strategy and project that we can work on. In workplaces, we are still encouraging people to be active and remain active as much as possible. What else? So technically, we're just encouraging everybody to utilize best practice to stay active in the community. And also in schools, one of the projects that I work with one of the local schools is the Safe Route to School. So the Safe Route to School, we help the school to maybe like renew or create a sidewalk, of course in collaboration with the city, just so that they will encourage kids to come and walk and bike to school. So that's part of mine. All right, and I'll let you guys have here.
Thank you. We skipped tobacco-free, so I'm going to jump in here quick. The commercial tobacco-free context area has really grown this year and allowed us to do more tobacco work, so that's been very exciting this year. In the past, we've contracted with ANSWER, the Association for Non-Smokers, and they really worked on smoke-free multi-unit housing, so apartment buildings, making them smoke-free, things like that. So that work really isn't happening right now on our level, but we are doing more, bringing in more of our tobacco compliance checks under the SHIP grant, so they're able to pay for that. We're able to sort of streamline those processes, make it a better partnership with the sheriff's office, starting to incorporate those local police departments as well. And also working on looking at the density of our tobacco retailers. You guys know very well from the last board meeting that we're, sort of keeping those setbacks in the 1,000-foot radius, 700-foot radius, whatever, but keeping them away from those youth-oriented facilities so there's less advertising done directly to children. Another thing that we do under this, or are hoping to do because it is new, it's sort of just in the learning phases, we are partnering with our Wright County GIS and Finance and Taxpayer Services to work on a map for the public to sort of see where the retailers are and work more on their end to see where they can put new locations and where they can't. And then also make it easier and more methodical for us to do our compliance checks while everything is out on a map. So that's where our tobacco works. And we can also work with schools. It's not really in the works right now, but I mean, it kind of is, I guess. We do use youth from our local schools to do the compliance checks with us. So healthcare is always an option for tobacco, whether you're referring someone to a quit plan, and then doing some tobacco cessation programming as well. So all of that falls under this context area.
Chairman, can I ask a question?
Yes.
Does it include vaping? Because that, the safe schools, quite an alarming trend with the THC coming in, especially in the vape pens, and they're seeing a lot. That's probably the most they've ever seen, THC. Is that part of or is it just tobacco?
Well, I mean, technically it falls as just tobacco, but you don't always know what's in them. So if you just treat, the promoting smoke-free as just being smoke-free in general, I think that's an okay space too, because obviously our goal is to limit, secondhand exposure and things like that, and that is whether there's THC or whether it's just vaping juice, they'll call it, you try to promote non-use as a whole.
As a whole.
Yeah. Does that answer your question?
Yeah, thank you.
We know it's a problem.
It's crazy.
And our last context area is MN Wellbeing, which kind of covers a lot of different aspects of our different settings. Just to list off of some of the projects we are currently working on and under MN Wellbeing is we are promoting social emotional learning curriculums in local elementary schools. We're also doing outdoor accessibility and partner up with functional industries. We're also doing a truck mentoring project with Timber Bay, and also a meditation garden with a local church with 23 acres in St. Michael area to really promote that mindfulness and also just gaining some peace in some locations. And also another project we'll be doing is fall prevention programming with Wright County Community Action, which Kai has been working really well to promote on that structure and coming to get it out to different homemakers. Would you like to mention anything else?
Well, so I'm on the workplace strategy. So with the workplace, I've been reaching out to a lot of chambers to get more partners, to get the community especially to get involved in the project so they can change their workplace setting and workplace settings. For example, I've been talking to Delano Chambers to see if any businesses are interested in developing a workplace wellness in their work sites, to see if they're interested in changing any of the PSC change within the work environment. I've been attending a few of the chambers meetings just to promote SHIP out there in the community so that they're aware of what we, Wright County has offered for them.
Another component of MN Wellbeing is also our opioid work with Ellie.
Yes, so we are actually the only county who currently does opioid misuse prevention work underneath SHIP. We were part of a pilot several years ago where we and St. Louis County were the two who piloted it. It was never expanded beyond the pilot period, but we continue to work on it with permission, of course, from MDH to work on it. And so that's myself, Becky, and Megan does some as well. And that looks like a lot of medication disposal work. So we do take back day twice a year. We partner with our sheriff's office for that, and local banks. We are working on some more like brick and mortar take back locations. We also do some screening work. It's called SBIRT, Screening Brief Interventional Referral to Treatment. And that's done in more of the healthcare clinical setting.
And then all of our opioid settlement advisory council or management of that national opioid settlement also falls under SHIP for the time being. So, yes.
So those are the context areas. One thing that we've been working on recently is putting together a project guide that is currently still a little bit in the works. We wanted to make our projects feel more attainable to community partners. And so not only was it us doing outreach to community partners, but also if they were to look and try to find SHIP, they would have a better understanding of what types of projects could be done with SHIP as a partner. And so I think we have like something like an 18-page guide. It looks a little bit like what you see on your screen right now, different projects, different potential partners, what the goals are and what SHIP can provide. This is just to help create a better understanding for everyone of what SHIP can do in the community and who we can partner with. We're also working on getting a project interest form up on our website. And so if someone has an idea for a project, they want to propose it, they can just pop in like a quick couple sentences, name, contact information, and we can start the ball rolling on our end of what it would look like to work on that project. That's everything we have, I think. We are more than happy to take questions.
Any board members?
You guys did a great job.
Perfect.
It's a lot to do. Thank you for all.
It's a big program.
Thank you.
Thank you.
Thank you for the comprehensive overview.
Yeah, thank you.
So moving on to the fourth agenda item here for timed areas, we have customer service survey.
Yeah, I can see if I can get replugged in here. Does it go on this side, Mason?
Close out of this one. This one here.
Okay, I think Mason will pull that up for you. So commissioners, we take the opportunity to do customer satisfaction surveys. If you notice emails you get from anybody from HHS and their signature box, it'll say if you would like to fill out a app or satisfaction survey. So over the years, we'll see in the next slide, the number of responses that we have. So total since we started is 658. Compared to the number of interactions with people, it's fairly low, but when people do want to reach out, whether they're not happy or happy with our services, it's nice to have a vehicle for them to do that we document. So you can see here the 4 years that we've been doing it, we actually had 193 people respond in 2022. Our satisfaction rate, so if you look at the little where the needle is pointing on this slide, boy, it sounds like we're starting over here on the extremely negative. So we have responses that are extremely negative. These would be folks that they might call us or contact us, and we're either not able to help them or not able to help them in the way that they would like, but we want to give them an opportunity to tell us about what the issues are. So we have 10% of those 693 responses are negative, 2% extremely negative, 2% neither positive nor negative, 3% somewhat positive, and 83% extremely positive. And again, this is over the 4 years of the satisfaction survey. So you can kind of see kind of a wide kaleidoscope of what that looks like. Of the respondents, 67% were customers, we would call them our clients. 18% were maybe just somebody else in the community, maybe responding regarding a family member or something like that. 11% were service providers, and 4% were other Wright County employees. The types of contacts that we obtained these the satisfaction surveys, 39% were via phone, 34% via email, walk-ins represented 11%, other 10%, the website 4%, and actual old-time mail 2%. And that is the presentation. So I just wanted to share that with you. If you think it's a value for us to continue to do the satisfaction surveys, we can certainly do that. It's kind of something that we've started at this point and document that as we go forward. When we do get us either a very complimentary or a negative satisfaction survey that actually would maybe talk about one of our staff or one of our departments or something like that within HHS, those all go to the supervisor, and the supervisor then addresses either great job, this is what this person had to say, or hey, what went on over here, we got, you were kind of called out on some negative interaction as this person perceived it. So we do follow up on all of them.
I just have a quick question.
Sure.
So out of 193 from last year, how many people do you serve on an annual basis?
Thousands.
Okay.
Yeah. So, these are probably,
It's a
people that
pretty
we would
small
direct.
number.
Yeah, and honestly, I think, I don't know if Rochelle is here today, but in our Min Choice area where we've come in contact with you specifically, I think that group in particular likes to give the people an opportunity to say, hey, how did we serve you? How well are we doing? Because they have like that long, sometimes 4 to 8 hour contact with the person, and they kind of develop a relationship. And so I think that area particularly has a fairly high ratio of those 193 respondents. But no, they just kind of trickle in. It's not like we're getting
There's no
lots.
other real strategy.
Right.
to
But if
get
you're
the
out in the
surveys.
community and you're talking to the community members and they say, well, HHS this or invite them to take our survey, because we do want to hear, so that helps us better serve people down the road. Thank you.
Thank you, Jamie. All right, now moving down to the HHS Advisory Committee minutes.
So we met on January 25th. Since it was our first meeting of the year, we did have a new chair elected, and that is Linda Antle, and a new vice chair, which is Bradley Gagnon. We welcome 2 new members, Kelsey Bessie and Vanessa Murray. We had a mental health update. You can probably see there what was discussed, a public health task force update. Again, the information is provided there. We had a presentation on the opioid, what Becky was just talking about, the Opioid Settlement Advisory Council update. They conducted a paper online community survey that started mid-January. It's closing, this would have been Friday in January. Survey aims for better understanding on how the funds would best be spent to save lives and have the greatest impact. So there they had 450 electronic responses as of January 23rd, and they were still working through the physical mailed responses or in-person responses. I did present the results of our employee engagement survey, which you saw a part of that already, and then some HSAC suggestions on how we could, because we recognize that recognition was one of the areas that we have a gap in, and the committees had made some suggestions on how we could maybe address that, and then we looked at some items for our next agenda, and then the meeting was adjourned at 3:49. Thank you.
Thank you.
Any questions? On the next item, I'd like to introduce Kate Dahl. She'll be presenting our 2022 final quarter financials for HHS.
Good afternoon.
Good afternoon.
Hello.
Get plugged in here, just give me a minute. All right, wonderful. Good afternoon. So I'm here today to present the Q4 2022 financials just for Health and Human Services. In front of you, you guys should have a packet of the full financials. Health and Human Services finished strong. The year was at 104% for revenues, and the expenditures were at 99%. I'm going to jump over to the graphs and talk about some of those areas. First up is going to be the income maintenance random moment time study. In Health and Human Services, there are 3 time studies that generate revenue based on administrative tasks within Health and Human Services, and this is just one of them. So our target for the year was $3.69 million. It came in at $3.26 million, mostly because the total expenditures for financial services were down in 2022. And since income maintenance is based on a reimbursement based on the total of expenditures, I do expect this to be lower. Some of the things that made that up, a large percent of that was due to personnel. In financial services, their personnel costs were around the 83 percentile range, so they were short staffed, which made the expenses lower. Also, the admin personnel part of Health and Human Services was at 89%. So overall, expenses were down in that area. So revenue was also down. Any questions on income maintenance? Otherwise, overall for financial services and child support, their revenue was at 96% and their total expenditures were at 91%. Gonna move off into social services. Social services, this is the other time study for social services. The target budget was at $2.33 million. Actual came in at $204. Overall, the social service expenditures are down in multiple areas. Just like the income maintenance time study, SSTS is based on the overall percent of expenditures. Statewide, there are some variables in this area. We are part of the statewide pool, so that could be the whole state could put in different random moments for different items. We are also reimbursed on that pool. Income maintenance is based on a countywide pool of information, so that is a additional area. There are some other trends we're seeing in this is there's a decrease in revenue based on Title IV-E. I know last quarter Christine talked about that and a project with Hennepin County looking into why. So that's something we'll have to continue to monitor in 2023 moving forward since it's still low. Other things we've seen was no Rule 25 admin revenue for quarter 4. So this will also need to be re-looked at. And personnel was down in this area also. Anything for social services on SSTS? Questions?
So one of the questions that I have kind of is in all the areas holistically.
Yep.
And when going through the time studies and trying to see the correlation of the unbudgeted opening or the unutilized budget. So we had open staff positions. So hence we would obviously get less revenue from the time study, but is it 1-to-1?
No, it's a percent.
It's a percent, but just trying to see if it's linear, you know, that because I know like there's a different percentage if we're opening admin stuff versus an actual worker, but then there's also the factor in the utilization of the group holistically. In trying to decide if you're down 10% in staff, are you going to be down 10% in time study, or is it?
Nope. So there's other areas which I'll get to next is like waiver and TCM. That's a 1-for-1 billable activity. So the worker puts in the time, we get to bill it. So that's a 1-for-1 activity. So these are all the other tasks that social services does that are considered administrative time. So it's not a 1-for-1. It's just certain areas of social services which would be calculated into this.
I guess my bigger perception is, okay, are we hurting ourselves even more by having open positions? So like if you're down 10% in staff, you're losing 15% in time study revenue. If that's the case, okay, then we're on top of the fact that we're building larger caseloads, we're actually underutilizing state funding as well. Because these graphs, I can't see that.
Yeah,
it's not detailed enough, and we're not showing it against the unutilized budget versus what we're getting for revenue.
Right.
And as Kate kind of said, part of it is because we're in the statewide pool, so we're at the mercy of what other counties are doing. So I think where you get away from that, Commissioner, is because there's uncontrollable things that if we're down, if we're down staff, yes, it impacts it, but other counties are going to impact it just as much. So I think that's kind of where that nebulous part comes in. In general, obviously, we'd rather have full staff so we can, and then, that admin time too. It doesn't mean a higher number of cases or that their case manager for doesn't necessarily relate to a higher, income or these random moments income, because sometimes you have more cases and it just doesn't, relate in that way because they look at overhead, they look at all these other parts of it too. I might be getting part of the SSTS and part of the targeted case management combined, but I think overall it's not a 1-to-1 and it's really hard to figure it out. Plus you're going to have less income coming in when they're new and they're doing training and things like that. So not only are we down staff, a lot of our staff have been hired in the last, I would say 6 to 12 months. So more of their time is going to be on the administrative time versus the other parts of the random moment that would potentially bring in more funding.
Yeah, and it's based on the activity they're selecting. So these are some of the categories that it gets pulled into on the SSTS, but on the worker side, they have like 60 or 70 categories they can pick from. So it's based on what they're working and the county pool of what they're selecting. So
and you'll see second from the bottom, there is that Title IV-E net that we're just really having a hard time cracking, that's down.
Yep, and that is
percent.
I can.
And then again, that means like who's presenting, are they eligible for Title E? If they're not eligible, we can't get that funding. So it's really the pool of people that we're working with as well. Sorry, there's just a lot of variables.
Yes, there are lots of variables. Good question. Any other questions on the SSTS area? Okay. All right.
Waiver is more straightforward.
Yes. I'm going to move into targeted case management first, though.
Oh, sorry.
No, that's okay. So targeted case management, we budgeted at 1.15 million. Actual came in above at 1.16. Looks like mental health was the largest increase across the board in that area, which impacted there. So this is based on a 1-to-1. We bill for a worker's time to support a mental health case or any TCM. So it's a one-for-one relationship there. Any questions on that? I'll move into waiver. Waiver target budget was 1.87 million. The actual came in above that at 1.89. Largely over the years, we have dialed in the budget, I think, between Jill and I. We've finally got to where the workers and where time should be. So the good news is we're where we would expect. Next one is out-of-home placement. Target budget was 1.38 million. Actual was 2.14. Looks like there is a large increase on the cost of placements in the higher cost facilities like correctional facilities and residential treatments.
And just to interrupt a little bit, Kate, so commissioners, this is an expense, not a revenue, so you're kind of looking at the inverse of the earlier slides.
And also there was a large increase in foster care, so which also went into the expenses. So.
Which is interesting because we were experiencing a lower number of children in placement, but a higher expense for those children.
Yeah. So quite a large increase
So
there.
it could have been worse.
Yes. All right, I'm gonna move on to the public health area. The target budget for public health was 2.5 million. In revenues, the actual came in under at 2.24. Largely due to lowered expenditures in most of the grants. Family planning grant had 81% of expenditures reported, which child and teen checkup finished at 41% of expenditures, and family home visiting also finished up at 66% of expenditures, and these usually are billed at that rate back to the grant, so then we see that in the revenue. I know the public health supervisors and managers have been doing an analyzing the work the workers spend. I know that's a work in process, but between personnel and professional service expenditures, that's where a lot of the decrease was in the budget. So, any questions?
Can I just say one?
Yes.
So the areas that we've seen an increase in, and the board has already heard some of this is related to mental health. It's the same on the adult side. We had a couple budget areas that if you look at the detail, the residential services for adults and kids way exceeded our budget. On the kids side for out-of-home placement, it's Rural 8, which is foster care, but it's a facility. So it'd be Rural 8, residential, and then much less so correctional. But those are the two. Rural 1 foster care, our typical family foster care for child protection, is down. That is down. So just there's
There's
lots of
different
line items for out-of-home placements.
Yep.
Just to
And then
get
there's-
a little more clarity on that.
Thank you.
Thank you. This might be for the new commissioners, the first taste of our HHS budget, so you can see it's big. Thank you, Kate, I appreciate it. Kate is
Thank you,
standing in
Kate.
for our business manager, which we have a vacant position right now, so appreciate Kate's coming down and talking through that with you.
For sure, thank you.
All right, director's comments. June?
Yeah, so I just have a few things I'd like to share with you. One of them is that we recently received 2 grants in our adult services area that will offset costs in other areas. So now we're kind of moving on to looking at the 2023 budget, I guess. We received a crisis mini grant for adult mental health targeted case management for uninsured individuals from DHS for $25,000. Those would be costs that otherwise the county would incur, so that was good. Currently, about 23% of our adult mental health targeted case management, I'm trying not to say acronyms, so I have a lot of words. Targeted case management clients do not have billable insurance, so that's always been right around a quarter, so actually 23 doesn't sound too bad. Of course, with the unwinding of MA coming, we'll maybe see that number change in the future. So through that grant, we were able to capture dollars for our TCM services for those clients that don't have medical assistance. And then in our assessment team, and that was Diane Erkins who obtained that grant. And our assessment team, Rochelle Kramer, received a grant in $10,017. This was a COVID Response and Relief Supplemental Appropriations Act that allowed grants for DHS to enhance adult protective services to respond to COVID-19. So again, this is additional funding for that area that otherwise the county would be picking up the charge. Not in your packet, I wanted to share with you, though, a letter of support that we sent over to, Matt Trakel, I don't know what his title is.
Chief Deputy.
Chief Deputy, thank you. But we're looking at a law enforcement co-responder application, and we provided them a letter of support. Some of the things that we would like to see in a co-responder model that would enhance mental health expertise available during high stress or volatile law enforcement calls, reduces stress on individuals having a mental health crisis to deter violence and harm, creates a streamlined continuum of care for individuals having a mental health crisis, and the service costs countywide could be reduced based on the fact if we had a model like this. So that actually the law enforcement is pursuing a grant. At the same time, we would need to be looking for funding to step up and then have the social worker that would be tied to a law enforcement individual. So this is kind of our first venture in this area. I also wanted to share with you some very sad news. We found out this morning that Carol Schaefer's, our public health director since 1984 until 2017, passed away. She succumbed to ovarian cancer. She had really a huge impact on our public health division as a longtime public health director. She was a big influencer here in Wright County of many countywide initiatives. She was the mainstay, or I would say the biggest influencer and promoter of the original WOW van. I don't think you could even park that WOW van in this room. It was like a large van compared to the very smaller, succinct model we have now. It was very innovative at the time that Carol was finding funding and grants to cover something like that could go out into our community. She was part of the first implementation, too, of safe schools, emergency preparedness, and then just ways to mitigate disease and increase health in Wright County. Just a huge contributor to all of that. So we're just we're very appreciative of Carol's time here. I think her vigilant oversight during the time she was with us was really helped build the very robust public health department that we see now. So very sad to relay that to you commissioners. When I have an obituary available, I will forward it on to you.
Thank you.
Thanks.
If there's no other business to attend to, we'll adjourn the Health and Human Services meeting today here at 2:33.